How did I get through 4 years of medical school with ADHD without learning that ADHD in women presents differently than how it's described in the textbooks? For women, especially women in their 30s and beyond who are getting closer to that perimenopausal window, ADHD hyperactivity actually shows up in our minds more than it does in our bodies. Of course, it can still show up in our bodies, like us fidgeting, needing to tap our foot to keep focused during a presentation, but a lot of times it shows up as anxious, ruminating thoughts in our head. And we get misdiagnosed with things like anxiety at higher rates than men do because it gets missed and we get put on anxiety medication first. I'm gonna give you some examples in this video of how that actually shows up and give you some tools and solutions for what to do about it. That means you're gonna wanna save this video and share it with your ADHD bestie. I'm a doctor with ADHD and I help high achieving ADHD people just like you create systems that last a lifetime. Drop the word systems in the comments below and I'll send you more info. ADHD hyperactivity in women can look like your brain never slowing down, your thoughts going a mile a minute, your mouth runs faster than your head does, and you say things that you don't mean, can't take back, or regret. You might have thoughts come out and trip over your words because it's not even a fully formed thought yet. The simplest hack that I found for this is to simply place my hand on my heart while I speak. This helps me ground into my body and form a mind-body connection. It also subconsciously signals to the other person that you're talking to that you are heartfelt and what you're saying is something that you believe and it's not meant to come across as offensive or wrong. Even if you say the wrong thing, they're still going to receive your message in the way that you intended it a little bit better. Sometimes we lay in bed, we ruminate, we feel exhausted, we can't wind down. All of that is still hyperactivity. It's just internal. One of the tips I have for winding this down is to listen to things like audiobooks or yoga nidra. I love falling asleep to yoga nidra, or even just frequency tapes. I like listening to things like sound baths or sound therapy at nighttime as I'm falling asleep. If you like learning more about your neurodivergent brain, follow my channel and share this with somebody who needs to hear more.